Hello, my name is Aaron Worthley, and today I will be presenting my extra credit assignment for Anatomy and Physiology 1 with Dr. Beth Cohen. Today I will be introducing the technique of intraosseous infusion in the emergency setting. Intraosseous infusion is the technique of administering blood, fluids, blood products, or medications into the intraosseous space of the long bone, usually the proximal tibia. Intraosseous actually means within the bone. And the bone consists of the shaft, or the diaphysis, the ends, the epiphysis, and the growth plate, which is the epiphyseal plate. The intraosseous space is the area of spongy bone and the medullary canal of the diaphysis. The vasculature of the intraosseous space drains into the central circulation by venous canals. And I'm going to present a diagram of the humerus. Here you have the humerus, and you have the epiphysis at the ends of the bone. Then you have the diaphysis, which is the shaft of the bone. Then inside the bone you have the spongy bone area, which leads to your red marrow and your vasculature inside the bone. And here you'll find the nutrient vessels that are going throughout the bone. Intraosseous intervention has been used in the emergency setting for quite some time, and it's really used when patients are in shock, cardiac arrest, or if they're in an otherwise hemodynamically unstable condition. When our patients are in those types of conditions, IV access is really difficult because the veins collapse. The blood pressure has dropped dramatically. The blood pressure, to the peripheral veins really is absent. And it's very difficult to obtain IV access in those scenarios. The intraosseous space, it never collapses because the bones, they don't collapse. They're hard. The only way that, of course, they would collapse is if there was a traumatic injury at the site. So the intraosseous space, is readily accessible, and it quickly absorbs, any medications or any fluids just as fast as the IV access would be able to provide those same medications or interventions. The IO technique, as I said, it has been used for quite some time. For a very long time it was only used in pediatrics, because, especially children under the age of 6, because IV access in an emergency situation was very difficult. But it has recently been approved by the FDA for use in critically ill or injured adults. Now, I want to discuss some of the sites for intraosseous infusion. The flat bone of the proximal tibia is the most commonly used site. It's commonly used because of the ease of location with landmarks. The location is medial to the tibial tuberosity. Here's another diagram displaying that. So, here you have your tibia and your fibula. And then you have your tibial tuberosity, which is the bony protrusion at the proximal portion of the tibia. And medial to the tibial tuberosity is where you would find your location for IO access. Some other locations that are used are the proximal humerus, which is, up here, that little bony protrusion up there. You want to, of course, you could use the deltoid tuberosity as a landmark there. You have the distal tibia, or the shin, and then the distal femur is also used. And also, in adults only, the sternum can be used, and that location is at the manubrium. Now, IO equipment. Unfortunately, I don't have any to display because I don't own any. But I'll tell you a little bit about them. You have a manually inserted IO, which is called a Gemshadai needle, or a Cook catheter, which is manually screwed into the site. There's a a solid, sharp boring needle, which is inside a hollow needle. You have the Easy IO, which is a battery-powered IO, so it just zzz right into the bone, very easy to use. Then you have a bone injection gun. Contraindications for IO use: traumatic injury to the site. Really, of course, the first one actually would be if you have accessible IV access, because that's much faster and less invasive. Traumatic injury, osteoporosis, and osteogenesis imperfecta. And the last note I want to make is it's very important when performing this technique in pediatrics is to the location. You do not want to inject an IO needle into the epiphyseal plate. Doing this can damage the epiphyseal plate and really inhibit the growth of the child, or that long bone, and that would be a very bad thing to do that. That's why the landmark of the tibial tuberosity is very important. So that's my presentation on intraosseous infusion and access and techniques. Thank you very much, and it was a great semester. Thank you.